Hi, I'm Sam Cox, and
I'm Ryan Lee, and this is our presentation on the Hampshire FA's Play On Walking Football League. Firstly, we're going to look at the problems in which the Hampshire FA Walking Football League looks to combat. There are two main problems that we'll be discussing here and our focus of our projects. The first one is inactivity. This is where people are not active and simply do not perform enough, if any, physical activity. So inactive person could be charged as a sedentary person, which is more popular as in older people, maybe in the kind of 70s age range and above. This is a problem that can affect a person's health, as well as the fact that sport can help their physical well-being, as well as them mentally and socially, which we'll get onto in a minute. So a study by Sibley et al. Found that inactivity in older adults is a growing concern. It's estimated that 5.8 million people over the age of 55 in the UK are inactive, and this figure increases significantly as the older people get. This highlights our problem, really, with how inactive people are and their older years. This also means that they don't get the specific health benefits from physical activity. These being the reduced risk of heart disease, the reduced risk of arthritis due more joint mobilisation, as well as more mental and social benefits that we'll get onto in a second. I'll pass on to Sam to talk about our next problem.
so the next problem is loneliness. So this is when a person is usually on their own and doesn't have enough or of any support network. This is a problem as it can affect them socially and mentally. So a study by Cambridge University and Victor et al. Found that 77% of older people feel they are lonely. This shows the big scale of the problem at hand and how people who are lonely, they need to get out, exercise and meet other people and feel a bit of a community and sort of mental and social well-being in themselves and stop them feeling lonely. So next, we're going to talk about the preparation of the sport policies and strategies. So the first strategy is Sporting Future, and it looks at more than just how many people are partaking in sport, such as what they get out of participating and what can be done to make people more physically active and gain positive from the sport, such as social and mental well-being. They are looking to change what success looks like in sport by outlaying 5 key outcomes. These are mental well-being, physical well-being, social and community development, individual development and economic development. Of these 5 key outcomes from Sport Future, our project focuses on 3 of these, which are mental well-being, which is through the sport. It makes them feel happy, makes them feel good, and mentally get some thinking through the sport and through the actual play of the game. Physical well-being, which is through the exercise itself and the walking football, get some physically active, get some up once a month in their sessions, get some physically active. And then social and community development, which is basically gets people together from different communities and local communities and socially communicating within the sessions, within talking to people what's in their age to them and get them socially activated.
So the other policy that helps with this project is towards an active nation. So the main focus of towards an active nation is tackling inactivity, which is exactly what our project's looking to do in terms of helping people's mental well-being, physical activity and social development, as Sam just mentioned there. One of the reasons this has been done is more than 1 in 4 people in England, so if you're happy at 28%, do less than 30 minutes of physical activity a week across all age ranges. This is a big red flag nationwide, as this is way below the recommended hours of an hour and a half for people to do in a week for physical activity levels. They also aim to work with specific groups of people that they feel are more inactive than others. This could be some women, people who are disabled and older people. So our project fits into this area by tackling inactivity in older people and helping them to get more physical activity and help them become more healthy.
So we're going to be talking about the SWOT analysis now, and basically we'll start with the strengths here, and the strengths are that it ensures that older people become active. So basically by this I mean that it gets them involved in the sessions monthly and gets them active within the sessions of walking football. It can be run by a small workforce. So what I mean by this is it can be run through a few volunteers, a main leader of the session, referees and other people to make sure that the whole place is safe and everything is set out well and all teams are on time to the match and stuff like that. And also due to these use of volunteers I just mentioned, it's cheap, which is good and can have a good benefit on it and strength. Improve social mental well-being for older people as well as coach and stuff like that, due to all the interaction between players and the play itself, which can help mentally improve people's and make people feel better. And also the excellent facilities that we're having the sessions in, which is brilliant, good facility of building, a brilliant playing ground. So it's really good for players and it can help them, and it's good strength.
So on the flip side of the coin, we have the accessibility to the ground. So for local teams, this might be quite easy, having bus links around near the ground itself. However, not all of our teams are already based in Southampton. We have a team that's based in Bournemouth. We have a team that's based in Havant and Waterlooville. We have teams that are based in Portsmouth and Gosport. So, for example, for these people where they have to travel in from afar, this could prove a bit of a problem. So if they cannot drive themselves, it's going to be very hard for them to physically actually get themselves to the ground to play the games, which is an issue we'll be looking to combat a little bit later in this presentation. With the facilities being excellent, however, we do have a slight problem with that, and that is we have a bit of limited equipment. So in our games, we will use a lot of flat markers to mark out our penalty areas for our goalkeepers and players. So we're having a bit of a shortage of those in the past few sessions. So this could lead to a bit of a problem with clarity for players and officials during games. So that's the last thing we really want. This is meant to be a nice, fun session, and we don't want controversy through decisions and due to not having the right equipment that could have potentially dampened people's enjoyment of the sessions. We also, at the Stoneham Lane Football Complex, there is a QR code that's on entry. So you would have to have a QR code that's either on your phone or on a printed out on a piece of paper that you can get from a website. With older people really not being the most technologically competent, this could become quite a problem if they don't know how to do this process. So if they don't know how to operate and work the QR code, it could be obviously hard for them to get into the ground itself. So obviously this is a potential drawback for activity for players. With this only being once a month, it raises the slight issue of, is this enough physical activity to do for players? So if you go from having one session in a month to then having the rest of the month, which could be 30 days in a longer month, of not doing physical activity, the physical activity aren't really going to happen as quickly as desired. Another issue with this is also it's not very easily adaptable to COVID-19, as we are working with a vulnerable people who are more at risk to complications from COVID-19 than, say, example, ourselves as younger individuals. So we have to be careful how we implement projects to reduce the risk.
So next I'll talk about opportunities. The first opportunity is to increase session frequency. So talking about earlier, the session's only once a month. It would be good to increase session intensity and we'll have more of them. That means basically we'll be able to ensure their physical activity and physical well-being stays better for longer by having more sessions. We could have additional social events to help them with their social mental well-being and confidence and stuff like that, to make sure that they're all mental and socially well. And then we could add more teams to league post-COVID-19, which will also increase session frequency, and it will just overall be a good development and expansion of the league.
So obviously with the opportunities and the weaknesses, there are things that could, go wrong if we don't address them. So for example, I mentioned earlier with the project, with only being once a month, potentially having a reversed effect on physical well-being. So this could become a threat, if anything, because the whole point of our project is to try and increase levels of physical well-being for our participants and people in the community as well. So by having the reverse of this, when people's health getting worse, is not a good thing for the project. It will make you question if we are physically doing enough for our participants. So just making sure that we can not have reverse the physical well-being effects is something we definitely need to work with. Looking at this as well, there's also the risk of aggravating injuries and conditions if we do add more training, more sessions in itself. People who might have muscle injuries, this could be potentially aggravated as older people take longer time to recover. So this could again start to reverse effects that we've already been working on and have the opposite effect of what we would like to have for the project. Also on top of this, there is the potential for COVID-19 spread if we don't deal with the problem correctly. So this is definitely the last thing we want to do. The whole point of our sessions is to get older people physically active and start to be mentally and socially improve their mental health and have more social communication. The last thing we want to do is to put them in a virus hotspot where they could potentially catch a disease that could potentially kill them if not treated, if complications do arise from it. So make sure we deal with the situation correctly and provide proactive and efficient COVID protocols and use are definitely a thing we need to work on and to have done in the project. So we now look at the pest analysis we have for the project. So this is the political, economic, social, technological, environmental and legal analysis. To start with political, so our project follows the current sports policy which supports the project. as it keeps people active and tackles inactivity in older people, as well as focusing on people's social and community development, mental well-being and physical well-being. As a project, we also need to have the relevant permits certifications needed for the activity. So our venue needs to have relevant safety certificates, a fire safety certificate, for example, and it's more like that, so they can be secure we're having an event in a safe area. But as well as this, we also need to have the relevant qualifications as coaches, volunteers, and obviously people running the activity. So we need to have a valid first aid on site, for example. Everyone needs to be DBS checked, just to make sure we all have a safe, secure network to run running the project. Economically, it's quite relatively cheap due to a small workforce, so which are volunteers. So on the last session, we had the volunteers. There was 3 volunteers. One was no longer here. We had the project lead, which is Jake, and we had 3 referees in space who were refereeing games. So this was a 7-man workforce, and it was quite a small work for us to run the project on. With 3 of us being volunteers as well, it's very helpful to save on budget costs. So all we had to spend was on referees and the food and drinks that we provided for the players during the session. Moving on from that, we have a ground which is owned by the Hampshire FA. This being a Hampshire FA project and them owning the ground is perfect, because then it means we save money on ground hire because we're using their facilities for the project. So which is always the best thing to have going for us. Also then we have team entry costs. So teams will pay to join the league at the start of each season. We could then potentially use this money to go back into the project by using it to pay for referees for the project, etc., etc. So this could result in us having a much smaller budget than other projects might need, as we can start to become self-sustainable, and we can then use less of the money that the FA is provided from Sport England or the government into these projects on this. So the Hampshire FA can use this in other areas as well. Social benefits are not just for players, but they're also for us as coaches and volunteers. So we can have nice conversations. You can improve your social mental well-being by having a network, so that people don't feel that they're alone. They can have a nice conversation, nice chat with people, can talk about anything which they'd like to, in a way. So it opens people up and makes it so we can all feel a bit more almost like a union of friends more than a football project. It's also helped people of a similar age meet each other. So we have different teams from different communities coming in. We can have the people, in fact, well, maybe not with COVID-19, but as we go forward, start to mesh, interchange, and talk to each other more. So having more people talk to each other could potentially expand friend groups and then potentially help combat the problem of loneliness, which we have in the UK.
So technologically, one technology used is the league website. So although technology is hard to use for older people normally, the league website is quite simple, not too complex, isn't too hard to use, and it should be accessible enough for these players to get used to. It's an FA website, all accessible. And then the next one is in the facility. We mentioned this earlier. There is QR codes to enter the facilities. This could be either through their phone or a print out a piece of paper to scan into the session, which should be simple enough for them if they get used to it. Next is the environmental. There's a bus stop near the ground and a bus route, which means it's more accessible for the local teams coming in. Although for the teams that are less local, not in certain area, it might be a bit harder for them. There's no bus route. It's played on an all-weather pitch, which means environmentally, unless there is extreme weather, it's unlikely to lead to cancellations, and also it's safer for players and less likeliness of slipping or something like that, an injury. So legal, especially now, it's even more important with COVID-19, because we have to follow all restrictions and guidelines such as social distancing, hand sanitizers, wear masks, and everything like that. Make sure everyone's safe. Next off, we have to have a valid and strong risk assessment in place, so making sure that the pitch is all safe, everything's on there, no coming in the way, nothing that can cause a slip. Even inside the facilities, inside the building, make sure everything's safe for all the people and there's no risk of injury. And also we need to have an effective fire procedure, so everyone knows it, everyone knows the fire procedure. Even though it's outside, we need to make sure that there's a effective fire procedure. And we also need to ensure there's a first aider on site to look after any injuries or anything happens to players, for example. Okay, so next up is the development plan. And for this, one of the goals and objectives is to get more people involved in the Walk Football League. The method of these are broader advertising techniques, such as flyers and notice boards, to make sure more people find out about the project, as well as talking to local clubs about making a team, join a league, and possibly available facilities as well. What's needed for this is that obviously advertisement resources, communication links, available facilities, walking football coaches, and marketing for new members and teams. How success is measured and how long it would take. So success is measured for this through more teams and players joining the league. So we can track this obviously through register and everything like that. And also aim for one new team of 6 players within 2 months. Potential problems that it could become expensive process from how wide scale the approach is.
So looking at another way we can maybe advance the project is increasing our sessions hosted. This would we'd arrange more sessions each month, and with potentially looking at adding more train sessions on top of these game sessions for players to help them do even more physical activity, which will help the physical well-being even more. So if we didn't do the train sessions, we would need walking football coaches to come in to help coach players of walking football. Even though they have a strong idea themselves, it's better to have an expert in the field to help them with it. Excuse me. We'd also need available facilities. Obviously, this not being a one-time a month, we need facilities that are available more than just the one times that we currently have. We then also need evaluation questionnaires, which we will then be using to measure how success is. So we give players questionnaires to ask how they feel about having these new sessions, which should combat problem of maybe the players not wanting it, to see if this is something that they would like. And then if we do have new sessions in place, we can then have a questionnaire on asking players on how this has affected them, maybe in multiple different ways. Along with this, we can monitor attendance of players for the new sessions to see how much the turnout is and if it's worth continuing doing these extra sessions.
So the next goal and objective of the development plan is to further improve social and mental well-being of players. So the method of these could be through more social events or chance to attend social events, such as meeting with people in general to talk and have like communication events, and finding local partners. What's needed for this is obviously an open communal space for the social events, a local partner, and marketing of events. How the success will be measured is through a questionnaire which we give the players to see if this is what they want and if this is what they need. And we also take names of attendees at social events so we can track if it's working and how many people are going. And potential problems could be friction of players falling out. This could be of players who maybe especially don't like each other, and it could possibly end up in them falling out and friction.
We can also look at another strategy of maybe opening more sites for the league. So this is how we could be running more sessions at different venues across the county. So this would help maybe reduce the issue of maybe travel issues. When people can't drive to Southampton for the session, we could set up maybe a session in the Bournemouth area or in the Portsmouth area. This would then be more accessible for those people and could potentially lead to having higher turnouts of new teams, which is how we would measure the success of this expansion. So what we need for this is we need more available and suitable venues to run the project from. We need the demand to do this from players as well. And also high demand in the local area for people who are advertising to do the sessions. And also we need to successfully enough to market the events so people actually want to take part and know what's going on. So the issue with this is ground hire could become expensive, as we obviously having to now hire for ground from somebody else. Which, however, this could be minimised if we start using the earlier point that Sam mentioned of talking to teams maybe about everything the facilities are available to use for these projects. So looking at the strategy map, our main outcomes really are to make sure that older people are keeping fit and performing more physical activity. Also improving mental and social well-being through conversation and interaction to avoid loneliness. So these double back to our goals early in the project, so keeping people from being inactive, and then also helping people to not feel to reduce the loneliness problem in the country. So our objective is to decrease the number of sedentary older people, and also to increase the number of older people involved in sport, alongside combating the olderness problem, which is obviously linked back to our outcomes. Which are the protective outcomes that we would like. So strategies for doing this, we could look into extra sessions, so like I mentioned there, looking to make more social events to help combat the loneliness problem in itself. Getting more people involved, so this would help more people improve their physical activity as well as their mental and social well-being. We can also look at, getting more people in, so looking at opening more sites for sessions. That's the one I was looking for. So we can look into this to make a local approach to help smaller communities to mesh with each other before maybe expanding them out into other communities. This also help with areas where they maybe are just well off, maybe people can't drive or haven't got a lot of money. This is maybe to help in the situation where we can make it more marketable to everybody. So tactics could be, so obviously to hire walking football coaches to help run more coaching sessions. This is obviously helpful with training sessions we mentioned earlier, to have coaches in to help players learn more effectively. We also need to have a good advertising program. Obviously, maybe not relying on technology so much, but using like word of mouth, using effective places that older people go, so that would be advertising in post offices, for example, or using notice boards, and using areas where we're more likely to attract the target market which we're going for. We could also tactics communicating football clubs. So we could get football clubs who are a bit of a power in their community to maybe form their own team. So they can form their own football teams to join the system. And also regarding that, we could also talk to them about their facilities. So we could have them maybe ask them if they would like to A, bring in a team, and then B, use their facilities to help run a project on a local level. So we can also help finding a local partner that works against loneliness in older people. This could be a charity or an organisation or a non-profit organisation that help to combat the loneliness problem in older people. So this would be an adjusted benefit that we mentioned at Sam's point earlier on. And then obviously you need more staff to help run these sessions on a more local level if we're going to expand it. So looking at the most, so our vision is we'll focus on the all sessions argument for now. So our vision is to decrease the number of inactive older people. So a study by Crombie et al. Found that 36% of older people do no leisure time physical activity, which just shows why there's a problem with inactivity in this country.
And our 4 objectives. The objective is to get more people involved in the World Football League in general, and this will also help to increase physical activity of older people by getting more people involved and obviously increasing the amount of physical activity.
So our strategy, because we can add extra training sessions to increase physical activity, this will not only benefit the physical activity levels of players that we currently have in the system, but also with these sessions being maybe at different times to when we run our other sessions, could help more people come involved in the project by them being available at the times we run these sessions. So it would then potentially benefit more people as well than just the people we already have. So obviously this is a major benefit for everybody really here.
And within tactics, we could hand out questionnaires to find out players want to have more sessions. And this also links back to strategy because if they want, it might not be what they want because it might not help with extra physical activity. But if you look at the questionnaires, we could communicate with them to see what they do want. They might want extra sessions of fitness to help increase their physical activity. And based on what the results are of the questionnaires, we can add sessions and communicate with people in the local area for new sessions and venues.
Yeah, so that was essentially what Sam said there. We can also look to advertise efficiently into the area as well to potentially attract more users.
Yeah. So looking at the monitoring and evaluation plan now, one of our outcomes is for higher levels of fitness.
So Matthews et al. Found that people aged 70 to 79 years old are about half as likely as those aged 50 to 59 to be engaged in high levels of physical activity. So this is a bit of a problem. Players getting older and people getting older and doing less physical activity could reduce the health benefits that they could get from doing more exercise. For example, we have a 73-year-old goalkeeper in one of the teams in the project. So having them involved will help them to keep more healthy and go forward. It also works with working on bettering people's mental health. And
Scharf et al. 2002 said that the UK revealed the considerably higher numbers of severe loneliness among people living in low urban income areas. This is bad as obviously it means that people's mental health will be struggling due to loneliness and not having anyone to communicate with and help benefit their social interaction. And speaking of that, more social interaction is also one of our outcomes. So Holtler et al. Found that socialisation and living alone are significant health risk factors and have shown the increase in the risk of mortality by 29 to 32% respectively. So this shows in itself a huge problem. So having social isolation and people living alone, we can't particularly help in the situation, which is a bit of a shame. But social isolation, having more people with a social life and outcome to get out to will help us to potentially reduce the risk of people dying from situations like this. Resources that we can use for all through the project really. We've got participant questionnaires and self-assessments, as well as monitoring attendance of who is actually attending sessions to find out who's getting the benefits and how we can maybe help to those who maybe can't attend as much. So for the outputs, this could be to increase participation for more older people in the Hampshire area. So Taylor et al. Found that age-related changes in the cardiovascular system can be reversed through increased levels of physical activity. So this is obviously a very important thing, as obviously as older you get, the worse your heart starts to perform. So if you can get in a situation where you can do more physical activity to make your heart healthier, this could potentially lead to a longer and happier life for all the people involved in the project. Yeah, and for this, resources could be attendance monitoring and questionnaires, and the risk could be that it could aggravate previous injuries and conditions, and old people might not be interested in the project. So the activities for this project are round robin matches for the league and additional training sessions and social meetings.
So what we could be proposing at the moment is we could have activity 1, which would be the continuation of the original format of round robin style match days, where every single team plays each other once, and these results then going towards the league table, which is then formatted at the end of the day. We then potentially have additional walking football training sessions, so this could be to help players to keep physical activity levels high and also help them in benefits by getting them more social links with each other. As well as this, we could also look at potentially more social meetings in community spaces. So this might not be, for example, physical activity in itself, but it's still beneficial by having social community development sessions in between people in the community.
And the risk of these could be potential lack of availability for leaders and participants. The sessions might not have the desired effect, and it might not be what all the players want. So our overall project review is the Walking League Football Project, obviously, with Hampshire SA, and it aims to combat loneliness and activity within the group of older people. The project lines up with the aims of current sport policies in order to keep the nation active and healthy. Originally, this was a once-a-month tournament round robin style format, which resulted in the scores being put into a league system. We have solid ideas in place that we feel will benefit the project and current participants in the way we set out to. We look to develop mental and social community development by bringing in people of a similar age from different communities to come together and communicate and socialise with each other. As well as this, we look to develop people's physical well-being by having them do more common physical exercise to keep them mobile and active so experience exercise benefits. Due to COVID-19, we have new potential options, and we will present these on the next slide.
So for now, we'll be going with option A, which would be postponing the walking football sessions until it is safer time, and there's a low to no risk of spreading COVID-19 between players with the increased rollout of the vaccine. So Brooke and Jackson found that older people are more vulnerable to COVID-19, alongside the CDC's research and people over 50 are 4 times more likely to require hospitalisation due to COVID-19 complications. So this is the last thing we want to spread between an older and more vulnerable base, is by giving them a potentially deadly disease that could benefit their life long term or potentially even end it. So, and also with the continuation, it might be harder for players to wear face masks or participating, which could be something we could do going forward. If they have breathing issues, this could be more of a hindrance than a positive thing. Looking at option B, when safe to do so, we could look at restarting the walking football session, in a more COVID-19 safe environment. So we could do this by having less teams per session, for example. Instead of having the full 12 teams coming, we could only have 6 per session, and then maybe space it out, so have a morning session and an afternoon session. So we have less mixing and intermingling between players, and we don't need to. We can try and avoid physical contact as much as possible, which is quite hard in walking football because there's a ton of sport. But at the same time, if we can avoid it where possible, it's better for all. It's better for reducing the risk of COVID transmission. Incorporating a one-way system and social distancing while moving around the facilities. So this keeps with the government's coronavirus guidelines and protocols to help obviously reduce the stress of the virus and to keep what's also keeping sessions running in an effective manner. We have masks worn while total players are not playing, because this would exclude people who are mask exempt, because we don't want to make it worse for them. So this is a way we can ensure that we can try and minimise the risk of spread. We could also space out games, so we can establish time slots to ensure that there's a minimum crossing paths between pitches to make sure we have a safer environment for those involved, as well as regular hand sanitising and disinfecting equipment, for example, disinfecting the footballs.
So option C would be to start walking forward training sessions with one team at a time to minimize contact with other teams. Avoid physical contact as much as possible, as Brian said earlier. Incorporate one-way systems and social systems when moving around facilities. Mask one at all times, not including exemptions. And for this one, it'd be one team at a time to keep up social links and physical activity up, but not have too much contact with other teams. And as I said before, hand sanitising and regular equipment disinfecting.
So that is what we've got for our presentation. So you can see a reference sheet here. We hope you understand that we found the best things we can find for the development of the project. We'd like to thank you for your time. I've been Ryan Lee.
I'm Sam Cox, and thank you.